It's the dawn of a new decade. You can be you again with mini dental implants. Do you suffer with loose dentures? Are you embarrassed to smile because you're missing teeth? Mini dental implants will change your life.
I've had problems with my teeth.
I couldn't eat almost anything.
I had this big hole in my mouth.
I knew it was time to do something permanent.
I'm gonna go and get this done.
It's just unbelievable what it's done to my life.
I feel like me again.
It'll be the best, smartest move you ever made.
Kind of gave me my life back.
The mini implants are the only way to go.
Just real happy I did it.
I would recommend it to anyone.
Do it over in a heartbeat.
It's been great.
It's incredible. It is. It's absolutely incredible.
I'm John DeSciullo, and welcome to Innovations in Health, and I am welcoming Dr. Thomas Baggett from Mini Dental Implant Centers of America in Springfield and Branson, Missouri. We are talking about the mini dental implant procedure. It will change your life. The mini dental implants are 5 times less invasive, less pain and discomfort, less healing time, less visits to the dentist, and less expensive. You can be you again with family and friends. It is a revolutionary technique. We want you to hang with us for the next 30 minutes. You're going to get to meet Thomas Baggett, and you're going to find out about the mini dental implant. Dr. Tom, welcome to the show.
Thank you, John. It's good to be here.
Yeah, it's good to be here with you. And I want to start by showing our viewers the difference between a conventional and a mini dental implant, showing that mandible, because it's quite dramatic.
John, I love to show this particular demonstration because it shows the typical size for a traditional implant. A very large hole is drilled, and then the implant is placed passively into the osteotomy. A little tiny small hole, it's only 1.2 millimeters, is used for a mini dental implant, and then we torque the implant into place.
And I know it takes a longer time with the conventional implant. What's the usual length?
If bone grafting is necessary, patients may find that they don't have a tooth restored from 9 months to a year. And because you've got to let that bone graft heal about 3 months before you go back in and then open it back up, you then drill the osteotomy, place the implant, close that back up, wait another 3 months, then you come back and open it back up again. And we do very minimally invasive procedures with mini dental implants. We simply make a tiny hole through the gum tissue, down into the bone, and place the implant. The whole procedure for a single implant might be 5 minutes versus the long procedure, disturbing the gum tissue, the blood supply, the bone, to drill the osteotomy for the traditional. And this is just a much easier procedure.
It's terrific. 5 or 6 minutes versus 5 or 6 months. I think
Exactly.
the answer is a given right there.
Exactly.
Now, if you have a denture, you're used to them swimming around on the bottom of your gums and there's no stabilization, the minis will stabilize and give you your life back. Show us how, Doctor.
John, my dad was a dentist, and for 40 years he practiced, and he would tell patients, I'm going to make an upper denture and a lower denture for you. I'm going to charge you double for the upper and give you the lower for free. And the reason is because the lower would just have a mind of its own. It swam all over the place, and patients that are viewing today that might be wearing a lower denture, you understand what I'm talking about. You're using your tongue, your cheeks, try to maintain it in place, maybe some adhesive, but we've got a solution to that. Now we can simply place typically 4 mini dental implants into place, and we're able to then snap your existing denture if your denture is usable, and then you're able to chew and your denture's not swimming all over the place. No more goo.
And no more goop. I think that's the most important piece of this information, because that adhesive, I can't imagine how that tastes. And you were even saying when people swallow it, it can stick to your intestines.
John, there's a story of a gentleman that was using the goop. He'd used it for so long, they thought he was having appendicitis. They opened him up and found the goop in there.
Oh.
So it's not good for you, it's unhealthy, and it maintains a lot of bacteria.
Now, odds are if you have a lower denture, you probably have an upper denture. And what's most interesting about the upper denture is the way your sense of taste is going to come back using the mini dental implant. Now, here in Missouri, we love our burgers. I have a lot of burger places here. We love our barbecue. We love to bite into an ear of corn and an apple. And now the confidence, the ability to do that, coupled with the sense of taste, is what the upper denture example will show us.
Exactly. This upper denture looks like a traditional denture that you might see. However, this particular denture is retained with the housings attached to these mini dental implants. We're able to remove the palate. Patients come in and they absolutely hate this one feature. Having a palate in place tends to cause the patient to gag. They can't sense hot and cold on their palate. They don't taste their foods the same. And when we remove that, that is a big deal.
That's a very big deal. So when we're going to go to that Route 66 food truck, we're there with the sense of taste all over again.
Absolutely.
Yeah.
I had a lady that came into my office who was 70 years old, had her family all together, had a birthday cake there. She went to blow out the candles and her upper denture went into the cake. No more with mini dental implants.
No more. So that's a terrific story. I
Yeah.
remember that. Now, I hear about the Diamond ZX. Now, it's not a car that Dr. Baggett drives. This is another example of how you can gain your life back with a perfect smile.
John, if you have the Diamond ZX denture, you may want to drive that ZX car. Compared to the traditional denture, you'll see a great difference here, how much larger the traditional denture is. The Diamond ZX is really just a reduced model. However, the teeth are different. These are 5-layer resin teeth that are Swiss made. They're impregnated with a rubber and a quartz, and they're just very, very durable. They last a long, long time compared to traditional denture teeth. The bar that's actually it's fabricated on is a fiber reinforced resin bar, and the high impact plastic is then characterized with composite and makes an absolutely beautiful appliance.
It's a beautiful denture, and it's exclusive with Dr. Thomas Baggett's practice. I know that several patients have had their lives changed as a result of the Diamond ZX. Let's read a letter from one of them.
Dr. Baggett and staff, for the first time in years, I can look in the mirror and not feel like crying. Even though my treatment isn't complete, I have no worries. You've all been wonderful and have made a tremendous change in me. Thank you so much. Miriam.
It's amazing to hear these testimonials. And I know, Doctor, on the Diamond ZX, 6 months is about the time spent between visits to you to make sure it's all good.
That's correct, John. The patient is able to wear this denture without taking it out for up to 6 months. We then take it out, we clean it, reglaze it if necessary, make any repairs to it. Another great thing about it is it's relineable, it's repairable chair side. If you have a broken tooth, we can put you back in business in just a few minutes.
Yeah, it's great that it's right chair side because it's happening right at your practice, and we'll give you the address in just a little bit. Now, if God gave us our baby teeth and our adult teeth, you're going to give us a brand new third set of teeth with this next example.
Sure. This is the what is called a Zirconia roundhouse. This particular unit is supported by 10 to 12 mini dental implants, and then the bridge work or crowns are cemented right into place, and these are permanently retained. These do not come out. We don't ever intend to take these out. You brush them, use a water pick, and they're fabulous.
Now, you can do that with an upper or a lower or both.
Correct.
And
you can do it with both arches.
And if somebody has issues in their mouth with various teeth, you'll extract those teeth to create the palate, if you will, and generate this brand new look.
Exactly. There is no palate here. It has the feel of natural teeth against your tongue all along the inside edges. You can feel the ridges as you would feel just as natural teeth emerge from the gum tissue.
Yeah, that's a great look, and the mini dental implant is what we're talking about here on Innovations in Health with Dr. Thomas Baggett. Now, here in Missouri, a lot of outdoors activity. You're an outdoorsman. You know what it's like when maybe you have a hunting accident or there's something that happens or your tooth just has a problem. So if you're missing a tooth, or God forbid you're neglecting teeth that are in the back of your mouth, because those are very important teeth, and you figured it's out of sight, out of mind. I know the shape of your mouth and the contour is largely defined by those back teeth. So if they're gone, you're not going to look good. But the mini dental implant with those back teeth and a single tooth will make a big difference. Let's show those back teeth first, Dr.
Sure.
Tom.
John, this same patient may lose multiple teeth. They may have a tooth missing here in the front or a teeth missing here on the sides, and eventually they may lose other teeth. The great thing about these mini dental implants is they're versatile, they're flexible, and they're like stepping stones. You can move from one appliance to the next simply by how we create this next appliance, but use the same implant.
And those teeth in the back are important because they are the workhorse teeth. They're chewing the food that we love here in Missouri.
They're there for grinding.
Yeah. And so the mini dental implant will help that out. It's almost like a bridge, if you will, a replacement too, if you have a bridge.
Absolutely. We don't need to affect the adjacent teeth. If these teeth in the past, if we didn't have mini dental implants, we'd have to crown this tooth and then fabricate a bridge across here. So we'd be cutting on good teeth. Today we don't have to do that. These teeth stay completely intact. We place the mini dental implants, and then we have their separate unit cemented into place.
And now let's talk about that single tooth, because we want to look our best, and if something happened, the mini dental implant, well, and this is something, by the way, folks, it's made in America. These are made in America products, exclusive for you. These are not something you take out of a box, is it, Dr. Baggett? This is something exclusive.
This is custom made for each patient, and this is a big problem in America. We're showing this example, but I want to make it clear there are 40 million people, John, in America that don't have any teeth at all. There are 175 million people that are missing at least one tooth. And this mini dental implant is an answer for 175 million people for the most part. If they have bone to support it, which we don't require nearly as much bone as would a traditional implant.
So it fits right on. That titanium post is what holds the tooth in place, and the bone grows around that titanium post. It's called, I think, osseointegration.
It is, and it's very quick. As compared to a traditional implant, which is placed in passively and then you wait for 3 months for the bone to grow around it. The mini is actually put in under torque. We place it in, and it's got this particular implant has an osseous coating. It begins to osseointegrate within 3 weeks. The bone begins to be triggered, and it thinks it's a root and locks in.
And it all happens in your office, and that office, by the way, is at 3840 South Cox Road, Suite F102 in Springfield, Branson, Missouri. Anywhere in between, anywhere that Springfield and Branson residents are, you can go and see Dr. Thomas Baggett and his team. And the phone number to call is 417-202-8334. The number's on the screen for the program. Write it down, share it with your friends, and the website, if you want to find out more, the really cool website right here for our area code in the Branson, Springfield area is 417minis.com. Dr. Tom, we talked about getting to know you a little bit. Where did you grow up, Dr. Baggett?
John, I grew up in Lake Charles, Louisiana, down on the Gulf Coast.
And you have so many awards. I just want to touch base on some of them. 8 honors from the LSU School of Dentistry. That's where you went, right?
Yes, correct.
And you're a member of the American Dental Association, the Academy of General Dentistry, the American Academy of Mini Dental Implants, the Missouri Dental Association. So many great, prestigious honors that you've had. How long have you been practicing?
I have now been practicing 40 years.
Wow.
Yeah, been
So,
a fantastic career.
What's interesting in that, look at how much has changed in the time that you started to practice until now.
Exactly. I started out, John, doing implants just immediately, but implant technology was nowhere compared to where it is today. And Dr. Todd Shatkin has done a lot for bringing this to the forefront, and mini dental implants have changed thousands of lives.
Yeah, he's up in Buffalo, and I know you fly up
in Buffalo, New York.
And then you bring all of that technology right back down here to Springfield and Branson for us to enjoy. Even those celebrities that are in Branson, if you're out there watching, give Dr. Thomas Baggett a call because you'll look your best. And you're an outdoorsman. You know, you've done some television, wrestling alligators, and all of the fun things that a dentist might do or not, depending on your mix. But one of the things that I love is that you and your wife have a ranch. What do you raise on the ranch?
John, we raise miniature donkeys. We raise mules. We've got gated foxtrotter mules, and we have foxtrotter horses.
Wow.
Yeah.
What's your wife's name?
My wife is Carol.
Carol. Yeah. And what's important about Carol is that Carol's in your practice, too.
She is my beautiful dental assistant, so if anyone hears me saying baby to my dental assistant, they'll understand there's nothing funny going on.
And your daughter's the receptionist?
My daughter's the front desk receptionist.
So tell us about these mini donkeys. How many do you have?
We've got 11 mini donkeys, and this year we're going to have some babies. And we've got 2 gated mules right now and 2 horses. At one time, I think there were about 80 on the property.
I know we have a photo of one of the mini donkeys. He's kind of driving a golf cart. Don't tell me he really drove that golf cart, Dr. Tom. But he's on his way. He's going to look good. He's in his minis. And that's the transition there, folks.
Yeah,
mini donkey, mini dental implant.
Minis are going places, John.
There they are. But you had a mammoth jack donkey.
Yeah.
And in this photo, he's kind of hung up on a fence.
I like that photo because it kind of, to me, it kind of says where people are. They're looking at traditional implants versus mini dental implants, and they kind of get hung up on the fence. There's good things about both, there's bad things said about both, but the truth of the matter are there are great studies that prove that mini dental implants are just as successful as traditional implants, but they're more versatile and they're less invasive.
Here in the American grasslands, which is what Missouri is so famous for. You're also a hay farmer.
Yeah, just as a kind of a hobby farmer, something to do out on the ranch. You've got all that grass, you've got to do something with it. So we bale about 7,000 or 8,000 bales of hay and sell hay.
Where do you find the time to do all this, Doc?
Technology again.
Yeah, technology is great.
Yeah,
and that technology is what you'll find at the Mini Dental Implant Centers of America. You know, we talked about the Diamond ZX, and we talked about that maybe being a fun car, but it's a great appliance for your mouth. But, you know, we're used to buying our cars on time. We're used to paying mortgages for our home. And I know that on the website, 417minis.com, you begin the process to work with the patient, because it's a free consultation, but you'll also consult with them on how they can afford the mini dental implant. How do you do that?
That's true. And John, we have great financing options for patients. You know, with just decent credit, they're able to get really approval for most any procedures that we do and find a way to pay for them.
When you do a consultation, what do you discuss? So say I'm the patient coming in, what would you ask me?
Well, basically I'm going to ask you why you're in my office first and make sure that we're meeting your chief complaint. And then we're going to talk about the kind of the overview of everything, because if you're focused on one tooth and yet you need other things, we need to talk about that before you make a decision about the one. But then we'll talk about minis versus traditional, give you an opportunity to ask questions about that, build a treatment plan for you. We'll do a cone beam x-ray.
Cone beam, talk to me about that, because that's 3D technology.
Yeah, it sounds kind of like something from a spaceship.
It
that
does.
Comes in, but 3D x-ray has given us the ability to look at the bone from 3 different dimensions and be very, very specific in how we do our treatment planning and how we actually place our implants. We use surgical guides that allow us to take a very rifled approach at placing that implant versus just kind of a hope it hits the right spot.
And I remember as a kid, you'd go in and get that gum template. You'd have to hurt her with the gum in her mouth, and then you'd look at the tooth. But this is a whole technological way of doing it, so you can pinpoint where the tooth goes.
Exactly. It's a digital world, and computers have helped us tremendously in implantology.
And the fact that you don't have to have your life relegated to soft foods anymore. You know, like I said, we love our burgers here in Missouri. We love our barbecue and our thick, juicy steaks. So that sense of confidence is going to come back. And I know that the patients that you've worked with, tell us about one of the patients that came in. They were kind of down and out, but you gave them their life back.
John, patients, and I'm speaking to a lot of people that are going to relate to this, can become very depressed over the fact that they aren't able to chew like they used to chew. They don't look like they used to look. And their confidence goes down. Just going out in public, sitting at a restaurant, having a meal can be a big deal for some people. And I told you the story about one lady that came into our office, and we tried to just open her up and talk with her, and she was very depressed. She was discouraged. And she told me the story. It was quite a story, that she had not kissed her husband for 2 years. She hadn't had a meal with her family for 2 years. She had quit her job and hadn't worked in 2 years because she was so discouraged by not having teeth. Sadly, her brother had the same situation and had taken his life. And so we put mini dental implants in and stabilized dentures for her, and it's like a whole new lady. She went out, got glamour shots, went and got her resume put together, went back to work, and she and her husband are having a great time.
The fact that you're able to bring people back to the way they enjoyed life before, and age should not be a factor in this either. I mean, some people who have dentures may be a little older and figure, well, I've only got how many years left. But let's not look at it like that. Let's look at it as we can enjoy the foods and enjoy our family.
You are worth, at any age that you find yourself, enjoying life, enjoying the foods you want to eat. Currently, my oldest patient is 97 years old.
God bless.
And he'd call the rest of us a kid, and he's getting mini dental implants.
See? So it doesn't matter what your age. And we have some great videos that Dr. Thomas Baggett and his team recorded right at the center, right there at 3840 South Cox Road, Suite F102 in Springfield. Let's take a look and meet some of these great success stories.
I've never had very good teeth.
I have went for over 20 years without teeth.
I had had a lot of dental problems because I'm a diabetic.
My whole personality changed because I've always been known to have a big smile.
Constant root canals, which wouldn't take.
I had such a tightness
in the middle.
My history with dental appointments is that I've been traumatized.
Frankly, embarrassing.
Halfway through the meal, they'd come out and I'd have to run to the bathroom and put more goop in.
It was painful and nothing was helping.
Very embarrassing at times.
I was very reluctant to smile.
It was just really hard to get dentures to fit right.
Nothing ever worked.
And I found Dr. Baggett's website.
Called the number and they said to come on over, so here we are.
He did an exam and x-rays and said, yes, I did have enough bone. So yay, happy day.
They did everything they could to alleviate any concerns that I had.
That is the best decision I have ever made.
My experience was wonderful.
And now this one, it has a good shape. It feels so much better.
Now I have a full set of teeth. They're awesome.
I came during my lunch and now I have a tooth.
I just finished getting 2 teeth replaced in less than an hour. I cannot believe it.
He is an utter professional and perfectionist.
We're both proud of how we look.
I literally did not feel a thing.
It was not that painful.
It didn't hurt at all.
It was not painful at all.
It was over with in a matter of minutes.
There's nothing to be afraid of.
I was actually shocked at how affordable it was, and I'm very pleased.
I just can't believe I got my smile back.
It's so much better now.
It's amazing.
I'm again amazed that it was so simple.
His office staff is wonderful.
Doctor and the staff, bedside manner, just amazing.
It was just a really great experience. I'm very happy with my new smile.
It's amazing how you can eat, how you can chew and be who you are.
One of the things that my husband had always said was, I just want to be able to have a steak dinner with my wife, which in years we hadn't been able to do that.
I can't wait to go eat a steak.
So we're gonna have steaks now.
I highly recommend this service. You'll be happy with it.
I couldn't be more thrilled.
It worked out well.
I'm just highly recommend having the mini dental implants.
By all means.
That's where those videos were shot, right there, 3840 South Cox Road. It's the Mini Dental Implant Centers of America for Springfield and Branson, Missouri, and the Ozarks, anywhere in between. Call 417-202-8334 and the website 417minis.com. We talked about the fact, Dr. Baggett, this procedure really is practically pain-free and over-the-counter medicine if you even need it.
That's correct, John. It is minimally invasive. We're not really disturbing a lot of gum tissue in this particular procedure. We're not flapping it open or anything like you would do with a traditional implant. Not a big hole. We're not drilling into a lot of bone. We make a very small hole right through the gum tissue. Often, we don't even see a drop of blood. It's just that minimally invasive.
Wow, that's amazing.
We put the implant in, and the patient often can just do with the Tylenol, and they're good.
The Tylenol, and water pick, or water flosser, we should say, is what you would use to keep that mini dental
Some
implant
type of a
looking
water flosser and a toothbrush, and that's really, if it's a single implant, they can floss around it,
Yeah.
but typically water flosser.
So if you've been watching our show, Innovations in Health, and you just joined us midway through, we're talking about the mini dental implant procedure. If you missed the first part, we're going to show you these models. If you've been with us for the whole half hour, thank you for watching, but now we're going to really bring it home with these examples. So if you have a denture, a lower denture that's swimming around on the bottom of your gums, look at how the mini dental implant will stabilize it.
John, the typical lower denture just jumps and moves all over the place. It has a mind of its own, and with mini dental implants, we're able to place it in, snap it in, and no more goop.
No more goop, so it's not swimming around on the bottom of your gums. The goop is gone. Odds are if you have a lower, you have an upper. So let's take a look at the upper denture example, and now the sense of taste that's coming back to enjoy the great food we love in Missouri.
What's fantastic about this, John, not only the stability of it, but we're able to remove the palate out so the patient can taste their food again. They can sense hot and cold, and it doesn't gag them. There's no gagging, no goop is required, and so a lot of you that are watching this, I'm sure you can relate to this. That palate being gone would be tremendous.
And that sense of taste is what we love. Now, the Diamond ZX, we're going to talk about something that's exclusive to Dr. Thomas Baggett's practice, the Diamond ZX.
The Diamond ZX is a fiber reinforced bar that's overlaid with high impact acrylic and then characterized with composite. The teeth are a Swiss-made 5-layer tooth that is really very, very close to the strength and compression feeling of natural teeth. There's no more clicking or clacking of teeth that you would hear with porcelain. And it has a lot of wear resistance, impregnated with particles of rubber and quartz. So it's very wear resistant.
And I know this is exclusive to your practice, and it's another addition as to why you want to go to the Mini Dental Implant Centers of America. Now, with that, if God gave us our baby teeth and our adult teeth, Dr. Thomas Baggett's going to give us our third set of teeth with what we call the roundhouse.
John, this is just a fantastic product. It is a zirconia bridge. The teeth are all bridged together. 10 to 12 implants are used, and we're able to then take the bridge and cement this in place permanently. These are highly successful. Of course, with zirconia, you have great wearability. They just last and last and last.
It looks terrific, and this is a product that's, takes a, what's that line? It takes a licking and keeps on ticking, because these are tough. This is going to do what teeth are made to do.
Exactly, and in most instances, we're able to fit it right against the gum tissue. People are able, or patient is able to take their tongue and feel the inside of the denture, and it will feel just like their natural teeth would feel if they were emerging from the gum tissue.
Permanent, cemented in, come into the practice to get a checkup here and there.
Exactly.
And with that, upper or lower?
Upper or lower, either arch. They are permanently cemented. We would take an x-ray to confirm that everything's okay, probably every 6 months to a year, but we want to see how they're doing.
And if you have teeth that are in the back and you've neglected them, or you have some issues, the mini dental implant procedure is the answer, and the same with a single tooth as well. Show us, Dr. Baggett.
Sure. With a patient who is missing teeth in the posterior area, traditionally we would have had to crown this tooth and this tooth, do a preparation on each one, then make a bridge that fit into that space. But with mini dental implants, we do not have to alter those good teeth that are adjacent to the space. We simply put the implants in, then make the units to fit perfectly into that space, cemented permanently, and they are a fantastic restoration.
Made in America product. Now look at this single tooth example.
Patients a lot of times will have one tooth in the front that breaks off for some reason, or they get in a car accident or whatever. We're able to remove that root, place a mini dental implant, and just immediately put them a tooth back into place.
It's terrific. It's technology that has advanced what you can use and what you can do to give you your life back. Dr. Thomas Baggett, the Mini Dental Implant Centers of America, 3840 South Cox Road, Suite F102 in the Springfield, Branson, Missouri area. The area code is 417, the number 202-8334, and we love 417 because that's the website, 417minis.com. So just as your father taught you and learned from the best, you are now learning from the best and bringing all of that technology right back here to Springfield, Branson.
That's correct, John. My father was a dentist, and he learned from Dr. Leonard Linkow, who was considered to be somewhat of the father of dental implantology. And as he brought that back to his practice, as I was actually a teenager practicing or assisting him, and got excited about it when I got out of dental school, began doing implants, and now Dr. Chad Chatkin has brought mini dental implants into our lives, and wow, what a change.
What a change, and we're bringing all that technology to us right here for all of us in Springfield, Branson. Thanks for joining us on Innovations in Health, Dr. Baggett.
Thank you for having me, John.
You are welcome, and thank you for watching.